Our next person to come up is Mark Ashcroft, and he's representing the Canadian Pulmonary Fibrosis Foundation, normally known as CPFF. So let's welcome Mark, who will talk to us on their initiatives. Welcome, Mark.
Perfect. Good morning. I'm a member of the board of directors at CPFF, but I think more important, I'm a patient. I had a lung transplant 20 months ago, and sorry, is that better? Sorry. So I had a lung transplant 20 months ago, and ideally, with the board, we have 10 members. We had 4 patients on the board till recently, and that's important to get the patient perspective. Unfortunately, by the end of the year, I'm going to be the only patient left on the board. We've lost 3 of them due to personal reasons or health reasons. So we are recruiting board members if anybody is interested. Let me just... There we go. So we represent for patients all across Canada. And our founder, Robert Davidson, breathing should never be hard work. And that's so important. I don't know if anybody's ever seen the Pucker Up Challenge. You hold your nose and put a straw and try and breathe through it. And it just shows you how difficult it is. And if you start exercising, it really shows how hard it is to breathe. And that's to give people a perspective of what some of us go through. So, pulmonary problems. Under the radar. This is so true, especially with primary care physicians. A lot of the times you don't get referred to the respirologist as quickly as possible. We did a recent survey, and diagnosis time is down. So from the survey, it's not down significantly, but it is coming down. So hopefully education is helping out to get it quicker. Patients were telling us they felt unseen. I think that is when they're first diagnosed, they don't look sick. And people find it hard to believe that you've got such a terrible illness when maybe you just got a little bit of a cough. So we're trying to educate people on that. And a lot of people don't want to share it because people just look at them and think, you look healthy, so you're coughing a little bit. It doesn't seem like it's something so terrible. And this is a big one to me, life-altering for the caregivers. It's horrible for caregivers. I know when I was sick and I would cough, all of a sudden my wife would be standing by my side. I'm 20 months post-transplant. If I cough, it's still that way. So it's still hard on her. So just think about that with your caregivers because they go through a lot too. Oxygen is not... Oh, there you go. There we go. Is that better? Can you hear me at the back now? Okay. Oxygen, this is a big project they're working on right now. It's so different across the country. How you qualify for oxygen, how much the government pays, what the suppliers will supply. Every province is different. And even what the suppliers give you, like, when I had oxygen, I could get as much as I wanted once a week. I lived in an urban area. Rural areas in Ontario where I'm from, they might get it once a month, and sometimes they're limited to how much they can get. It's horrible right now. So we've been lobbying the governments and working to try and make it standard across Canada. Recently dealing with a patient who was moving to Nova Scotia from Ontario. Found out after they listed their house for sale that she could not get the oxygen she needed in Nova Scotia. The amount she needed to be active, they didn't have a system to supply it. We talked to the government officials there. They weren't even the least bit sympathetic. They said, everybody here moves to Ontario to get a transplant when they get that high. Well, that's not true. Not everybody wants a transplant. Not everybody qualifies. So we're trying to work with the governments to get that across Canada, same qualifications, same payments. Recently in Ontario, they did away with the yearly qualification. Like a PF patient who's on oxygen isn't going to get better. maybe if they get a transplant, but so they've done away with that yearly qualification. The payment, trying to get that covered, it's over 65, a lot of places it's covered, but under 65, there's charges. So I'm working on that. That's the big project we're on right now. The next project coming up through the works is going to be pulmonary rehab. Our board just passed a motion to work with the respiratory therapists to try and develop a standardized program throughout the country. And it would be available remotely and in person, because in person just doesn't work for everybody. So that's the next project as we continue on with the oxygen. And I have to say a big thanks to the Vancouver Island support group, because they're the one who pushed this forward and kept pushing it, so the board reacted to it. It's very important that CPFF hears from patients and support groups, because we want to do what you need. I'm a patient and I understand, but some of the board members don't. So if we hear from you what you need, we do that survey every couple of years. The information that we get, we compile, and that helps us decide what actions we're going to take. So if you have concerns, have your support group send it in, or if you want to contact us, send it in. We get enough on the same thing, and that'll help us to act. More deadly than a lot of cancers. It's absolutely true. A lot of cancers, people get so upset somebody has cancer, but so many cancers are curable. There's treatments. What do we have? We have 2 medications right now and maybe a lung transplant. So it's terrible disease, and a lot of people just don't understand that. Okay, breathless for change. We need to get some change to make this better for us. So there's over 30,000 Canadians, and the number seems to be going up exponentially right now. So the vision is a world free of pulmonary fibrosis. Our mission, to improve lives for Canadians living with pulmonary fibrosis by compassionate support, advocacy, awareness, funding research, and inspiring hope. These are the 4 pillars that we try and go by. So anything that we're doing, any project we take on, we try and put it into one of these pillars. Patient and caregivers, something to help the patients and the caregivers. Education and awareness, educating the patient. There's lots of information on our website. We don't offer medical advice, but we can point you in the right direction. All kinds of good information there. Education for healthcare professionals to try and make sure that the patient gets to the right person that they need to see at the right time. Research, we do fellowships. Every year we give out 2 fellowships to doctors to do research. And advocacy, we're advocating the various levels of government to try and get different things like the oxygen, the pulmonary rehab. Right now we're also working with the Rare Disease Organization, because the federal government has a lot of money available that they've said was going out to rare diseases, so we're trying to work on that. Questions? If you don't have any right now, you can send them into CPFF or...
I'll just actually make a comment. You've mentioned Robert Davidson and the fellowships a couple of times, but I just wanted... Oh, I'll use the mic.
Yeah, good. I was coming up to talk about it.
I just wanted to highlight that both myself and Dr. Marinescu received our training funding, and that supported our research to basically get where we are. And now, we run a lot of clinical trials within the province, so these fellowships matter. The work that CPFF does is great. And then we have another new fellow. There's Nama Avitsur, who's over here, and she's currently doing her fellowship with Dr. Ryerson as well. So a lot of really good things come from this. Yeah, thank you so much.
I'm glad to see there's some people here that have got the fellowship. That's awesome. And I'm here for the day if anybody has any questions.
Well, we'd really like to thank you for coming. He's come out obviously from Ontario. Thank you very much. Thanks.